Hey everyone, Chris Kiefer here, SkEye Media, Oral Surgery, Branding and Advertising. And today I want to talk about the point of stain, and in particular the point of stain for an oral surgeon. So the first question is, what is the point of stain? And that is, point of stain comes from a Tide laundry detergent back probably over 15, 20 years ago. There was a advertising committee that was sitting around the table and talking about when people or when the consumers think about buying their product. And what it came down to for laundry detergent was they realized that really the only time in anyone's life that they consider and or think about what laundry detergent they're going to use is at the moment that you spill something on your clothes and you stain your clothes. So that is the point at which your clothes, or the point at which you have been stained and you are thinking, oh no, I need laundry detergent. And they developed a marketing or advertising campaign around that concept. And they wanted to make sure that when a consumer did stain their clothes, that their detergent was in top of mind, and that's when they thought, oh, I need to go get Tide to get the stain out of my clothes. So that was for Tide laundry detergent, that was their point of stain. Now for oral surgeons, what is the point of stain for an oral surgeon? I think that's an interesting question because a lot of times when we're talking to oral surgeons, you hear that they don't need marketing or advertising because they get all their patients from referrals. And I would say I 100% agree with that, because 95% of an oral surgeon's production comes from dentists. So because that means that you're moving oral surgeons out of a business to consumer type business, and now you are business to business. So because you are now a business to business company, there is still room for marketing and a need for marketing in that space. You just have to think about the point of stain from the oral surgeon perspective. So what that means for oral surgeons is that you have a patient who you have probably never met at this point. They go to the dentist. They're sitting in the dentist's chair, they get some x-rays, the dentist comes in and the dentist is looking over the x-rays and says, oh, Mr. Smith, it looks like you have a wisdom tooth that you're probably going to want to get taken out. And I would recommend that you do that within the next several months, and you go to an oral surgeon to do that. And then at which point the patient, if the doctor has not already said so, would say, great, I need an oral surgeon. Which oral surgeons do you recommend that I go to? And that right there is the point of stain for a oral surgeon. It's the moment when the patient is sitting in the dentist's chair and they are made aware that they need the service of an oral surgeon, and they need to decide which oral surgeon they're going to go to. So you jump back into that story, and what typically happens in most cases, the dentist will say, well, I recommend that you go to Johnson & Johnson Oral Surgery down the street, or Smith & Smith Oral Surgery. They're both great. I've had good experience with both of them, but they're the ones that are in town, and I trust them. 20 years ago, that would have been all that patients needed, and that patient would have said, thank you very much, Mr. Doctor, and I will head down the street to the oral surgeon, and I will get my wisdom teeth taken out. The thing is that in today's world, people are beginning to crowdsource the information that we're receiving. So whereas you used to just take the doctor's word for it or take your friend's word for it, nowadays people are crowdsourcing that information. And what we mean by crowdsourcing is they're looking at a greater population and getting the opinion of the masses, basically, to determine whether or not they want to go to this store or business or movie or song or whatever it is that their friend or respected colleague told them. So for an oral surgeon, yes, we acknowledge that you are getting your business from dentists, but we need to make sure that the dentist, first of all, knows to suggest your name. And then second of all, when they suggest your name and that patient goes out and verifies that what the dentist said was true, that you've got reviews and you've got the reputation and the website and all of the other assets to back up what the patient is looking for at that time. So that's what we mean by the point of stain. And that's what we do when working with oral surgeons, is we help focus on all of the marketing efforts around that decision-making time that happens when a patient is made aware that they need your services. And that's where your marketing dollars and efforts should go. Hopefully this was helpful. If you have any questions, feel free to shoot us an email, leave us a comment. We'll be sure to respond to all of those. Thanks for joining us on this journey, and we'll see you next time.